Health promotion and maintenance. Which health screening does the nurse perform on this client? Now, health screenings we do for everybody. Like, you should be able to come up with about 20 different issues right off the bat that we can screen people for. Which health screening does the nurse perform on a client who is a 30-year-old woman?
Breast exam.
A clinical breast exam. Huh?
Pap smear.
A pap smear.
Do a pregnancy screening.
Are those routine?
No.
So if we're looking at routine, maybe not. If she's come in with symptoms, maybe yes.
Mammogram.
She's 30.
Not yet.
No.
Breast gene for maybe cancer. But that's not never mind.
routine
I
either.
give up. I gave my one.
Blood pressure.
I said blood pressure.
So,
Vision or hearing?
vision or hearing. So at that age, no other complications in the stem. We're looking at pretty basic stuff, right? Whereas if they do come in and they have a family history of that gene, where we're saying, okay, you had an aunt who had the BRCA1 mutation, those people, we are going to go ahead and send them for a mammogram. That would be in their screening maybe, right? So it depends on what else is in the question. Let's say that we change the screening to the client comes in and has a 20-year PAC history. What does their screening include?
Problems for lung cancer.
Hypertension.
Hypertension,
Chest X-ray.
maybe a chest x-ray. But the really fun thing is now we don't have to start with chest x-rays for people who have significant smoking history. Anybody who has a really significant history for lung cancer can go straight to a low-dose CT because they're more specific and they do a really good job of catching it sooner. So that might be one of the things that's up to bat for this person. Do we want to look for other signs of heart disease? Mm-hmm. So what kind of screening does that include maybe? Cholesterol, maybe an EKG just for a baseline, those kind of things. Which is the best teaching for a client who is at risk for diabetes? So what kinds of answers could you insert here?
Diet, exercise.
What about diet?
A heart-healthy diet.
What does that mean?
Low carb.
So if the answer just says heart-healthy diet, you don't have to think about that, right? Whereas if it says low-carb, high-fat diet, you're like, no, that's no. I don't want them to have lots more fat. Diabetes is heart disease. Let's don't do that. Where if it just says you want to keep them under 100 grams of carbs a day, yeah, that might be good. What other teaching for someone who's at risk for diabetes? We said,
Besides exercise.
what kind of exercise?
Low impact. Maybe
At least
like
30
a
minutes
cardiac, like walking.
So we want them to start off with something that's going to be aerobic, but kind of low key, and make sure that we can build from there. Do you want them to do it every day?
3 times a week.
3 times a week. So like if the answer says every day of the week, well, yeah, we'd love for everybody to do that. Is that what you teach people? No, you teach them at least 3 times a week because most people can manage to fit that in. And that's what science says is going to be useful for right now. Who knows what science will say in 2 years, but for right now. All right, the nurse in a community health center screens clients at risk for developing, let's just stay with coronary artery disease. The nurse identifies which client has the highest risk. So these people come in, what condition would indicate higher risk? And we've said coronary artery disease we're going to try with, so risk factors.
Someone who smokes.
Smoking.
Obesity.
Obesity.
Family history.
Family history. Now, if we make each one of those a little bit more specific, so if we go with obesity, instead of saying obesity, maybe the choice says a BMI of 19. Is that fat or not?
No.
That's not an obese person, right? So you're actually not going to be worried about that. If it says a BMI of 39, yeah. Okay. So for the person with cirrhosis, what risk factors would you screen? What kinds of things are you including? The person is at risk for developing cirrhosis.
Someone who drinks a 12-pack of.
Alcohol use and the amount of alcohol. So not just alcohol use, but definitely the amount. What else?
Hepatitis.
If they have a history of hepatitis, is it all hepatitis? Mostly B and C, but if they had a really bad bout with A, that could also lead to cirrhosis potentially. Anything that's damaged the liver. So what other things?
Drugs.
Increase
Drug
medication.
use. Specifically, if maybe they use Tylenol a lot, you might want to ask them, how much Tylenol do you take in specifically? Fatty liver disease is now leading to cirrhosis. So again, you might come back to some of those teaching points for coronary artery disease and diabetes, that kind of thing. Those could all be in this select all that apply question.